Dissociative identity disorder, multiple personality disorder or split personality disorder. In ICD-11, dissociative identity disorder corresponds to the concept of ICD-10 multiple personality disorder and is renamed to be consistent with currently used nomenclature in clinical and research contexts. The ICD-11 also introduces partial dissociative identity disorder, reflecting the fact that the preponderance of ICD-10 unspecified dissociative disorders is accounted for by presentations in which non-dominant personality states do not recurrently take executive control of the individual's consciousness and functioning. Essential features: dissociative identity disorder. Disruption of identity characterized by the presence of two or more distinct personality states, dissociative identities, involving marked discontinuities in the sense of self and agency. 1. Each personality state includes its own pattern of experiencing, perceiving, conceiving, and relating to self, the body, and the environment. 2. At least two distinct personality states recurrently take executive control of the individual's consciousness and functioning in interacting with others or with the environment, such as specific aspects of daily life, parenting, work, or in response to specific situations, those that are perceived as threatening. Changes in personality state are accompanied by related alterations in sensation, perception, affect, cognition, memory, motor control, and behavior. There are typically episodes of amnesia inconsistent with ordinary forgetting, which may be severe. The symptoms are not better accounted for by another mental disorder. 5. The symptoms are not due to the effects of a substance or medication on the central nervous system, including withdrawal effect, and are not due to a disease of the nervous system or to a sleep-wake disorder, hypnagogic or hypnopompic states. The symptoms result in significant functional impairments if functioning is maintained. It is only through significant additional effort. Additional clinical features: dissociative identity disorder. Alternation between distinct personality states is not always associated with amnesia. That is, one personality state may have awareness and recollection of the activities of another personality state during a particular episode. However, substantial episodes of amnesia are typically present at some point during the course of the disorder. In individuals with dissociative identity disorder, it is common for one personality state to be intruded upon by aspects of other non-dominant, alternate personality states without their taking executive control, as in partial dissociative identity disorder. These intrusions may involve a range of features, including cognitive, intruding thoughts, affective, intruding effects such as fear, anger, or shame. 2. Perceptual, for example, intruding voices or fleeting visual perceptions; sensory, for example, intruding sensations such as being touched, pain, or altered perceived size of the body or of part of the body; motor, for example, involuntary movements of an arm and hand; and behavioral, for example, an action that lacks a sense of agency or ownership. The personality state that is intruded upon in this way commonly experiences the intrusions as aversive, and may or may not realize that the intrusions relate to features of other personality states. Dissociative identity disorder is commonly associated with serious or chronic traumatic life events. Boundary with normality. The presence of two or more distinct personality states does not always indicate the presence of a mental disorder. In certain circumstances, for example, as experienced by mediums or other culturally accepted spiritual practitioners, the presence of multiple personality states is not experienced as aversive, and is not associated with impairment in functioning. Course features. Onset most commonly associated with traumatic experiences, especially physical, sexual, and emotional abuse or childhood neglect. Dissociative identity disorder usually has a recurrent and fluctuating clinical course. Some individuals remain highly impaired in most aspects of functioning, despite treatment. Individuals with dissociative identity disorder are at high risk for self-injurious behavior and suicide attempts. Although symptoms can spontaneously remit with age, recurrence may occur during periods of increased stress. Recurrent or chronic ongoing traumatic experiences are associated with poorer prognosis. Dissociative identity disorder often co-occurs with other mental disorders. In such cases, identity alternations can influence the symptom presentation of the co-occurring disorders. Developmental presentations, onset of dissociative identity disorder can occur across the lifespan. 1. Initial identity changes usually appear at an early age, but dissociative identities are not typically fully developed. Instead, children present with discontinuities of experience and marked interference among mental states. Identification in children can be difficult because symptoms manifest in a variety of ways that overlap with other mental disorders. Young children often project their dissociated identities onto toys or other objects. With adequate treatment, children with dissociative identity disorder tend to have a better prognosis than adults. Older patients with dissociative identity disorder may present with what appears to be late-life onset paranoia or cognitive impairment, or atypical mood, psychotic or obsessive-compulsive symptoms. Culture-related features. Features of dissociative identity disorder can be influenced by the individual's cultural background. For example, individuals may present with dissociative symptoms of movement, behavior, or cognition, such as non-epileptic seizures and convulsions, paralysis, or sensory loss, in sociocultural settings where such symptoms are common. These symptoms typically remain persistent and debilitating until the underlying dissociative identity disorder is identified and treated. Acculturation or prolonged intercultural contact may shape the characteristics of the dissociative identities. For example, identities in India may speak English exclusively and wear Western clothes as a sign of their difference from the usual personality state. In some societies, presentations of dissociative identity disorder may occur after stressful exposures, for example, recurrent parental affect dysregulation, which may or may not involve physical or sexual abuse. The tendency toward dissociative responses to stressors may be increased in cultures with less individualistic, bounded, conceptions of the self or in circumstances of socio-economic deprivation. Sex and/or gender-related features. After puberty, prevalence appears to be higher in females. Significant gender differences have been observed in the symptoms of dissociative identity disorder across the lifespan. Females with dissociative identity disorder often present with more dissociative identities and tend to experience more acute dissociative states, for example, amnesia, conversion symptoms, self-mutilation, than males. Males with dissociative identity disorder are more likely to deny their symptoms or exhibit violent or criminal behaviors. Boundary with partial dissociative identity disorder. In dissociative identity disorder, discontinuities in agency and sense of self are marked, whereas in partial identity disorder these discontinuities are less pronounced. In partial dissociative identity disorder, one personality state is dominant and functions in daily life, for example, parenting, work, but is intruded upon by non-dominant personality states, dissociative intrusions. Unlike in dissociative identity disorder, the non-dominant personality states do not recurrently take executive control of the individual's consciousness and functioning to the extent that they perform in specific aspects of daily life, for example, parenting, work. However, in partial dissociative identity disorder, there may be occasional, limited and transient episodes in which a distinct personality state assumes executive control to engage in circumscribed behaviors, for example, in response to extreme emotional states, episodes of self-harm, or the reenactment of traumatic memories. In partial dissociative identity disorder, the non-dominant personality states are not elaborated to the extent observed in dissociative identity disorder. 2. For example, they may not be oriented to the present, may have the identity of a child, or may be mostly or exclusively involved in reenacting traumatic memories. 2. In addition, there are typically although not always, significant episodes of amnesia in dissociative identity disorder, which may be severe. In contrast, episodes of amnesia in partial dissociative identity disorder, if present, are typically brief and restricted to extreme emotional states or episodes of self-harm. This does not occur in any other dissociative disorder, except possibly for limited circumstances in partial dissociative identity disorder, as described above. Please like and subscribe.